I am very excited to be here with our panelists to discuss an extremely important issue of equity. So I'm Lori Pepper, and I lead STV's Mobility Technologies team in the southeastern and central regions of the country. I joined STV a few months ago, and I'm proud that STV was among the first AEC firms to sign the landmark Equity and Infrastructure Project Pledge in 2022. This committed us to advancing equity and infrastructure with a goal of increasing the number, size, and percentage of historically underutilized businesses growing to prime contractors, participating in joint venture, or becoming equity participants. And we intentionally build our proposal teams to work towards that goal in our pursuits. Before then, I was the Deputy Secretary for Innovative Mobility Solutions at the California State Transportation Agency. And in that job, I was charged with applying technology and best practices to the transportation ecosystem to make it easier for people and goods to move throughout the state. So I began that job in late 2019, which was not long before the COVID pandemic. And when COVID first hit, we saw some operational changes that were beneficial for some or even most people, but had unintentional consequences that needed to be addressed for others. So for example, restaurants set up dining areas outside on the sidewalks, which was great to provide a place for people to go and a continued revenue stream for those restaurants. However, taking up the sidewalks meant less space or no space for pedestrians. So the city took the parking lane for a pedestrian path. However, people with certain mobility challenges couldn't step down or up on the curb, and the barriers didn't leave enough room for wheelchairs. So the city remedied these issues by building ramps and expanding the space for the, quote, new sidewalk. But it was clear that there was a need to consider all potential impacts at once and not issue by issue. And this term, equity, is really a broad term that can mean different things to different people in different situations. And so today's panel is comprised of public service professionals who work each day to make sure that movement of people and goods is achieved in an equitable manner. And so we're going to each hear from each of them about their work or their initiatives related to equity, and then we'll have some questions. So first up, we'll start with Kelbree.
Thank you. I am Kelbree Porter. I am the first Grants Department Director for the city of Montgomery, Alabama. The Grants Department was created in 2021, and up until about a year ago, I have been the only employee. Now I have a department of 4 staff, and through this department, we do all aspects of the grant cycle. So the community engagement, the grant writing, implementation, reporting, monitoring, everything related to competitive grant funding. We also conduct strategic planning and capacity building processes throughout the city to ensure that we can get more competitive funds. From an equity standpoint, we have created within our office the Office of Workforce and Opportunity. Through this department, we provide access to job training, wraparound services, as well as transportation. We also have we implemented the GAP initiative, which is the Grants and Partnership Initiative. Through this particular initiative, we bridge the gap between other entities and competitive grant funds. And so we work with individuals, businesses, nonprofits, help them to build capacity in order for them to apply for federal grants. We also work with companies to build their capacity to bid on grant-funded construction projects. And lastly, we have the Health and Human Services Commission, which is not our equity office, because in the state of Alabama, we cannot have certain offices, DEI offices. There was a bill passed in the last session. So this is our workaround to equity work. And this commission was created through a grant with the Department of Health and Human Services, as well as a grant from the Alabama Department of Public Health. And the goals and objectives of this particular grant were to pilot a community health worker model within the city of Montgomery, and to also conduct a community health needs survey. And from that community health needs survey, we've been able to identify infrastructure needs across the city and narrow those projects down by neighborhood. And so that way we can build a plan and a plan of priorities of infrastructure projects in the city. Since the inception of this department, we have been able to secure $73 million in grant funds. So in 3 years, $73 million. Thank you.
Always a secret. Sorry. Good morning. My name is Diana Alarcon. I'm the director with the Department of Transportation and Multimodal Infrastructure here in Metro Nashville-Davidson County. First, let me welcome y'all, those folks that are visiting us from somewhere else. Welcome to Nashville. We're super excited to have y'all here, and we're excited to be hosting Infra Day here in Nashville. While you're here, we hope you have a good time. Get out and eat some of the food. We have great barbecue, as well as there's a lot of other great restaurants. We are known as a foodie town, as well as our popular party town. And also, while you're here, please visit some of our attractions down on Broadway and enjoy the honky tonk. Great live music, you can't beat it. But there are also a lot of other great things about Nashville, and that is there is some great history here. And so we hope if you are going to be here for a little bit, you take advantage and learn a little bit of history about. My favorite thing that I learned when I first moved here was about Fort Zachary Taylor. So would recommend learning a little bit about the history and the Civil War that it actually was part of Nashville. But anyway, on to about the Department of Transportation. It is a relatively brand new department. It was actually created in July of 2021 as part of the prior mayor's transportation plan. And in that, it was recognizing that we were struggling with having the ability to move transportation initiatives forward. So the department was put together. It included engineering, planning, as well as the public works side of it, of maintaining the roadway network. So basically, we're responsible for the right-of-way from back of curb to back of curb. And that includes everything from engineering, designing, building, cleaning, you name it, we're taking care of it. So, and it's a big challenge. We also are responsible for the traffic lights in the system, and I always like to say we are responsible for building the new infrastructure that supports our transit operations. And I'm super proud of this opportunity. The department was also created to start thinking about multimodal. And so that's looking at how our sidewalks are built, how our bikeways are built, how we're supporting our infrastructure for transit, and as well as the continual movement of cars. So we've actually, over the past 3 years, have done quite a bit. We've updated our walk-bike plan. We've as well put together a strategic plan of how we're going to move forward over the next 5 years. And part of that strategic plan also included an engagement plan for our community. And in that is a very specific component of talking about equity. And as was mentioned earlier, equity to me is very subjective. I've had the opportunity to live in and work in 3 separate cities for government, and in each one of those cities, I have to say equity was something different. It's very subjective. So it's really understanding what your community's initiatives and your community's drive and desires for. And some of the ways that we've been able to be successfully in getting that done is what I call a multimodal master plan. You know, we've in government have always been really great about doing plans, but not necessarily putting plans to action. So the multimodal plan actually takes everything that's ever been done, throws it in, overlays it, has a chance to take a look at it, decide where you have repetitiveness, maybe where you have gaps, also where maybe it doesn't make sense anymore because the landscape of your community has drastically changed due to development. And here in Nashville, we've had a dramatic change over the past 10 years. It was really an extremely fast-growing city. So it's really looking at all of that aspect, not starting from something new, taking what's already been done, and then taking that information and going out to the community and saying, hey, what do you want? And I will tell you, we have a very divided community. I have a community out in some of the country and rural area, do not want sidewalks, do not want wider roads, want it to stay to 2 winding roads, beautiful landscape, just as gorgeous, and that's their desire. What they would like, though, is better ditches built to support the stormwater infrastructure. and stuff along that. Then as you get into the more urban area, we have communities that would like to have improvements, but they also want those improvements to make sure gentrification doesn't happen. So how do we build in that element of not gentrifying a neighborhood as well as doing infrastructure improvements such as sidewalks? I also want to add, right now, and I'm sure many cities are feeling this, we're having serious challenges with demand in the use of the curb. And so that's part of the infrastructure challenge we're having. And it's not just in parking. A lot of people think it's about parking, but it's not that. And it's really kind of elevated here in Nashville because of the amount of, and how large our entertainment district is. But it's about getting goods and services delivered to the retail establishments and to the restaurants and as well as to the hotels. Is about getting people into and out of the downtown area or other areas that we have entertainment districts so that we have workers that are available. It's also about making sure that we can support the newest innovations that are occurring, such as Uber and Lyft. And I mean, that was a great thing. We all had taxis before that. Uber, Lyft came out, that you could do it, but Uber and Lyft actually is a very big impact to the infrastructure, and not many people really think about it that way. So how do you best use the curb so you can accommodate all of these new infrastructure strategies that are coming on board? Scooters are another thing. I mean, that's all of us have been inundated with scooters in our city, and I don't know how some of the, if there's other government agencies in here, or even if you're experiencing it, it's a big challenge, but yet we have found that the scooters that are used in our city, 27% of them are actually used for that first and last mile trip, so they do play a very significant role. And so how do we make use of all of this? And so we are doing it through our multimodal master plan, and then with that, we're actually using our current new community engagement program to make sure that we're having those conversations with all of our different community members so that we're building out that infrastructure, not for just today or for tomorrow, but for what will be in the next 10 to 20 years. Thank you.
Thank you. And I know the curb management strategies is huge, not just for cities, but for airports and transit hubs and multimodal hubs. And it's a big, I don't want to say problem. It's an obstacle that I think we're all trying to.
These are challenges we did not have before.
No. Yes. Great. So I'm curious, how do each of you define equity in your work? Do you do it from kind of where you sit, or do you do it based on your intended audience, or is there a different strategy?
So from our perspective, we had to create a different definition of equity. And so for us, our definition, when we're discussing equity, it is community-centered health disparity reduction. And so we look at things from a health disparity lens to ensure equity, and it's a little bit more, it may sound like a lot, but it's a lot easier to explain to individuals why we are pursuing a particular project from a health disparity standpoint. So it's easy to look at actual health conditions and determine, okay, if we want everyone to be at this level of health, what is needed for each individual in order to obtain that? That's equity. So there are different issues, there are different solutions for different people, but when we address them through a health equity lens, it's a whole lot easier, and it's easier to talk about. And so when we talk equity, we usually are referring to it in a health disparity reduction. So
great, thank you.
So just real quickly, who has ever heard of Vision Zero? That is fantastic to see that many hands go up. I usually do not get that type of a response. But for those who are in the room who are not familiar with Vision Zero is about getting to zero fatalities in your city. Nashville is a Vision Zero city. It was actually something that was being worked on when I moved to Nashville, and I was super excited about it. It is actually an action plan on how you're going to get to zero fatalities on your roadway. What's great about Vision Zero is it focuses on 5 E's. The first E being engineering, being how you design your roads, how you design it for all of the uses, make sure you're including all the modes. It's also about engagement, so really understanding the needs and what your community wants. It's also about encouragement, so encouraging people and giving them the opportunities to maybe try a different mode, something new. And it's also about enforcement. You always have to have that double-edged sword. Enforcement is actually a very critical component of it because, you know, we're all human beings. We all try to take shortcuts. We all try to bend the rules a little bit, and that's great for sometimes, but it may affect somebody else, and that becomes an equity issue. And then, of course, is about evaluating. And each one of those E's, equity is built in, and you must have those conversations. When you're designing a roadway and you're trying to figure out what's the best design, data. I have to throw that out. You hinted to it, but it's extremely important, and there's some great data out there to help you form those decisions that are best for your community from a health. So it's really evaluating what is it you want to get to, understanding that core result that you want, and then figuring out what data you want to pull into it. So if it's health that you want to drive, how do you do that? It amazed me, you know, in Oklahoma a few years back, the mayor decided that they actually had been listed as the heaviest community. You know, there was actually a national survey done about the city that had the heaviest amount of people, and it was Oklahoma City that actually won. And the mayor didn't like that, so he put on a challenge and challenged the whole city to lose weight. And they did it by data and also by identifying the benefits. And then with that became the programs, the equity put in it, what were some of the challenges. And so I think it's really important that when you're doing that, you understand what it is actually from an engineering perspective, what you're designing for. Are you designing just for the car? Are you designing for the pedestrian? Are you designing for the neighborhood? Are you designing for a major arterial? Those are all really important questions that you need to ask. And then how does that, and then what are the benefits that you're trying to get out of it? So we really take those 5 E's in Vision Zero. We kind of cheat and apply that across a lot of our practices because it really is a good way of making sure that you're tackling all levels of equity, because equity, again, is very subjective. And it can, what you consider equity may be something that never even crosses my mind. I mean, I was blown away when we had a chance to talk earlier in the week and she was telling me about the new law that passed in Alabama. I went, holy cow. Talk about an obstacle. But look, they got together, they figured it out, what is the benefit, and then they found a way to get around it. I don't want to say get around it, that's not the proper terminology. They found a way to work with it. Right, and right. So, and have, you know, some positive outcomes. $73 million, that is fabulous.
Well, we saw it coming. So we saw it coming in the midst of completing our community health needs survey. We saw the need to change our focus strictly from equity to health disparities, and we've been able to apply that through that community health needs survey. So when we went into these neighborhoods, we utilized community health workers who built that relationship with the community, and there are contracted workers who go in to conduct this survey, and we always come back with either a health fair or health services. And so through the survey that we received back, we got a response regarding infrastructure, violence prevention ideas, mental health solutions, and they were all different, not by zip code, which we initially thought to look at. It was different across neighborhoods. So neighbors had different ideas of what that looked like, and as well as the community engagement. We, when we go into different communities, we use different community engagement techniques than we would across the board. So normally our community engagement would be come to City Hall, we have a public hearing, that's it. Now we come to churches at the end of the day, at the end of the church service. We come to basketball games. We definitely come to football games because that's what we do. So we are able to get people where they are. We're no longer making them come down to City Hall, and we understand that we're not hearing the voices that we need to hear and the solutions that we need to hear because we're busy doing the same things over and over again. So when we go into the historic district, we know there are certain particular concerns for the historic district, and we address those things in that matter. And then there are other places where no one stops, so we use yard signs to let them know that there will be an event in their area. So you have to be very flexible when it comes to addressing equity.
And so you both have talked about being more neighborhood specific, and there is no one size fits all. Which,
that was in the earlier session.
Yes, that's true. And so considering, you know, I did not realize you were one person until recently.
Yes.
That's a lot of, you know, engagement to manage. That's a lot of different metrics and outcomes that you want to measure. So how do you get your arms around all of that and ensure that you are making progress and that you are headed towards a Vision Zero or whatever your goals may be?
Well, with me, I use money to make money. So, like before with that particular grant, the initial focus of that grant was to increase health literacy, increase vaccinations, and increase testing, which did not increase at all. And halfway through the grant, we realized that we still had 75% of that funding, so we asked, could we address health disparities on a larger scale? And because the community was not receptive to us doing testing, can we do health fairs? And so when thinking about what type of data we needed, being a new department, I understood that all of the plans that we had were old, no matter what anyone would say, or they expired. So we needed new data. And through this grant, I was able to get that data for us to apply for more funding and create those partnerships with organizations who would be a part of those health fairs. We created a lot of partnerships that led to contracted work. And so we were able to get community health workers to start that engagement and bring back that feedback without having to spend more funding. Initially, when the grants department was introduced, the city council only approved for $250,000 for the department as a whole. And with the condition that if I brought more funding, then they would continue to have the department. And so the first year it was $4 million, the second year 12, and now we had a budget hearing. And when I went to the budget hearing, they were like, do you have any increases? I said, yes, we got $73 million. And they said, no, you have increases in your budget. I said, no, but I bought $73 million. That's not a conversation. We are here to do work, and we brought the money in. And so another thing that we do is in our indirect cost, things that we have not been able to do and things that we would like to implement on an equity level, we do through our indirect costs. So we pilot certain things out as administrative process in order to bring more funding in and bring more resources in. So those first couple of years, it has been extremely hard to do, but I think showing that it's not just an application, like a job application. There's an investment that must be had. Once we missed out on a few opportunities and had some conversations and technical assistance, we have received 2 technical assistance grants, one Thriving Communities and the other BRIC. And through those conversations with those individuals, they were able to say what I was trying to say, but from a different level. So it's easier for them to receive that information from someone outside of the city, because of course I have a vested interest, but hearing it from individuals from the Department of Transportation and other strategists to say, you have potential, but you can't live off the name City of Montgomery, Alabama. There has to be some work involved. And so that's ultimately how I was able to get to 4 employees, which we need about 8. But yes, that's the way we've been able to do it.
Great. Yeah.
Well, we just completed our 5-year strategic plan, which really kind of outlines how we're going to advance forward along with our performance measures and creating dashboards so that we can share with the community where we're at and what we're doing. And that has been, it is literally taken us about 9 months to get that done. It's not an easy initiative, but with keeping also up with your daily workload, but it's very satisfying. And so now we actually just finished it. We are producing our dashboards, and we actually just introduced our KPI measurements, and that really kind of lays out where we want to get. It entails everything we're already doing, so it's including our Vision Zero effort, it's including all of our plans, it's got built into our new multimodal master planning efforts, it has everything built into it, including our core services that we provide for our community. I cannot leave that out because the public works side of it, our core services, is so important just for the well-being of our community as a whole. And so we're really excited about what those opportunities will have to offer. Even just already looking at last year to this year, we're seeing some major progress. So that, I think, is going to be really helpful in us moving forward. I think it's also, one of the things that Nashville is actually going through is right now is we're putting a referendum on our November ballot for our community to consider dedicated transportation funding. And that's going to give a lot of additional workload for us. It's a 30-year plan, and the mayor has given us 15 years to get it built. So that requires a lot of strategic planning and analysis to make sure we can deliver. And we feel very confident that we'll be able to deliver that to our community. And it's because we've taken a lot of these measures to get ourselves very organized on everything we do.
And so I know we are being told to wrap up, but from what I'm hearing, it sounds like in order to really include equity metrics in work, you really have to kind of define where you stand first, then define where you want to move to, and that it could be different across different geographies and populations, and really the number of different types of metrics seem endless. But worthwhile.
Very much so. Very well said.
Great. Well, thank you all so much. Thank you both. Really appreciate it. And I'll turn it back over to Ken.